Hello, I'm Shelby. I'm a student nurse at Butler. Today I'm going to be showing you how to put a patient on a bedpan and then do an occupied bed change. My patient today is Chester. There will probably be surprise performances by Peaches the cat, but we'll see. So to start, what you will need every time for both of these is going to be gloves. I don't have any today, but you always don gloves for the bedpan. Don't have a bedpan, so we're using a plate. You'll have a bedpan, and always bring wipes. And then, if need be, some pads, because I know a lot of patients they have to have pads underneath them just because it's for accidents. So bring the pads too if you need them. So Chester needs to get on a bedpan, so we're gonna get him on the bedpan. So you would come in to knock, enter the room, do 2 patient identifiers. Make sure this is Chester. Introduce yourself, of course. So hello, I'm Shelby. Today I'm going to be putting you on the bedpan today, Chester. So what I usually do is I come in. I always get my supplies, have it nearby. I would raise the bed to where it's my level so I don't break my back. So what I usually do is I'll put the bed rail down on my side rail down, but keep the side rail on the other side up. And then first you uncover. Get them all uncovered. And then, obviously when you walk in, you do hand hygiene and put gloves on. So here's Chester, all of his glory. Depending on how much the patient can move, I like to roll people just because it's easier and it's easier to wipe them. But if they are strong enough, you can also have them bend their knees. His knees don't want to bend very good. So you just have them bend their knees like this. Okay, and then you just have them kind of pick up their hips. So depending on which way you like to do it, I'll show you both. So this is the way that they can just pick up their hips, and then you can just slide it down and have them sit on it. Either that, or what I always like to do is have them lay flat. I would put the head of the bed down so that they're flat, because it's always easier to roll when it's flat if they can stay flat. So essentially what I would do is I would make sure that there's plenty of room on the other side so he doesn't just fall out of bed. But I would tip him over and have them hold the side of the side rails. And then you just slide it under and then put him back. And then what I usually like to do is I like to sit up the head of the bed just because it kind of imitates sitting on a toilet. If they want to stay on it for a little bit, I always put the blanket back on them. So we'll say that he would like to, while I explain some things. So you would do something like this, have them just kind of hang out and sit on it as long as they need. I usually, depending, if they're a bigger person, I definitely do 2 people. If they don't turn very well, I would do 2 people just because it's safer and it's a lot easier on you guys. Also, they have 2 different sizes usually of bedpans. I've seen them both. They just have the regular ones that they just kind of shaped kind of like a upside down candy corn. And then they also have bariatric, which are a little bit wider so that they can actually fit right under the heavier patients. But for Chester, skin and bones, so we just have a regular one for him. But yeah, it's super easy. For this video, we're going to say that the sheets are soiled. So we're just going to go ahead and change the sheets too after we get done. But yeah, if they get anything on the pads or anything like that, you definitely want to go ahead and clean the pads. So we'll say that he's done. I'll get him off the bedpan. So then you just pretty much do the same thing. You have them turn or lift up, either or. And then you go like this, have them turn. Take the bedpan out. I usually set it away from the patient, or I take it into the bathroom. And then you would get your wipes. Always wipe front to back. Front to back, man, woman. Just easier and it keeps them clean. Just depending on how big of the job, take as many as you need. Make sure I always come in with more than you need, just because it's a little bit easier. And then if they have any dirty pads, anything like that, bring clean pads. so that you can just replace it. So like I said, we're going to go ahead and pretend that we did get something on the sheets and the sheets need to be changed. So with Chester in here, if you weren't already in the room, you could, like I said, you would come in, do your hand hygiene, don gloves, introduce yourself, make sure you're talking to the right person, and then tell them what you're going to do. So I would just tell them, since we soiled the bed, we're going to go ahead and do a complete bed change, and we'll get all these dirty sheets out for you. And so we're going to do that. And 9 times out of 10, I always bring a second person, just because it's easier on both of you, the patient and yourself, and it's a lot safer, because there's so many things that can happen while you're doing a bed change. So it's always better to be safe than sorry. So yeah, like I said, you'll need gloves, clean sheets, wipes again if you need them, because it happens, and definitely another person, just because it's easier. And then if you have like the bags in your facilities, things like that, definitely bring a bag too, so you can put all the dirty laundry in it. So I'm going to go ahead and get started with Chester here. So what I always do is when I first come in, whenever we're doing this, I take all the dirty blankets and stuff off of them first. And then what I usually do is I'll let them know that they're going to be uncovered for a little bit. If they don't really like that, you can definitely keep a sheet on them. So essentially, you'll have the side that you're on, this side will be down. On the other opposite side, you'll have the side rail up. So what I like to do is I have them come closest to me, get as close to me as possible, and then have them roll. Just because it gives them more room. And then I just grab all the dirty sheets and roll and then tuck. Tuck everything underneath them. So it's kind of like that. And then I come in with the clean. Ew. And then I do the same thing. I just do tuck, tuck, tuck. And then this side, I would basically just attach the fitted sheet the way it needs to be. And then, if you have pads, put the pads down. And then you just tuck, tuck, tuck underneath the dirty. And then all you do is you have them roll back like this. And then have them roll towards you. And then on the other side, you take out the dirty. And you unroll and get the clean. So once everything is rolled back out, you essentially position the patient back in bed, whatever they need to do. Always make sure before you leave the room to make sure the bed is at the lowest position possible. And also make sure they're comfortable. Definitely for people with skin pressure, injury risks, things like that, definitely not higher than 30 degrees on the head of the bed, just because the shearing and friction can kind of hurt their back and their skin. Also, if your patient is just uncomfortable, obviously you want to make them as comfortable as possible. And yeah, that's really all you do. You definitely cover them back up with the clean, everything clean. And then I always like to take out all my stuff, take out the sheets, and put everything in a bag, any trash that we have, and just kind of clear out the room. So just to make sure it's a clean environment for the patient and a clean environment for everyone that works there. Also, before you leave the room, always make sure the call-out is within reach and everything is within reach. And I always say before you leave the room, ask them if they need to potty, rearrange, everything, just to make sure that you can take care of their needs while you're there. But yeah, that's all you do. If they have any questions, you can answer them. But yeah, that's how you put a patient on and off a bedpan and change an occupied bed.